I would like to thank the IPS TN chapter office members of this RCBC committee. Before that, I would like to thank our IPS TN chapter office members directly, Dr. Sadanand, Dr. Babu Bala Singh sir, Dr. Arun Kumar sir, and then Dr. Satyamurthy sir and Dr. Arul Saravan sir and Dr. PP Kanan sir, who have been the backbone for this. As we all know, you have RCBC in South Zone as well as in Tamil Nadu chapter. This is RCBC of Tamil Nadu chapter, which we have a statewide journal club. And every month we see to that the fourth Saturday we conduct a journal club with one topic journal presentation, and the next month we will actually cover a topic how to write or how to do a case report or case series or how to write a original article or of some statistics class. So one theory and one practical journal club discussion. That's how we have planned this year. So last year it was headed by Sivaraman sir, I suppose. Now it is headed by Shivanand sir. So I am new to this, and next month we are planning to start with reference management software and also with case control studies as presentations. This time we will start with Dr. Sivanand sir. Before that, I need to tell and thank our RCBC committee members, Tamil Nadu, as I said. So it is headed by Dr. Shivanand, who is the today's speaker. I welcome you, sir, and I am also part of the committee. And Dr. G. Vanishri and Dr. Dheeraj sir, Dr. R. Munathan, and Dr. Divya and Dr. Sivaraman sir. So we all will take care that this happens every month in fourth Saturday. Now, before wasting time, I thought for the want of time, we will directly start with Sivanand sir. As you know, like he has worked everywhere almost. He was there in AIMS and NIMHANS DM Child Psychiatry, and now in JIPMER. He came from JIPMER and then he has worked in some three different kinds of institutes of national importance. So I hand over to you, sir. Sivanand sir, you can start today's topic, sir.
Yeah, thank you, Professor Maikantan. So, in this 1 hour session, earlier it was to be a 3 hours. We have reduced it for help the participants to be in more in number, especially for students, to 1 hour. So, in this important topic, I'm going to cover about how to write a case report or case series, especially in psychiatry. So, when we look at the level of evidence, the best evidence come from systematic reviews or meta-analysis, which is considered the highest level of evidence for anything, especially for a treatment. This thing. So the randomized control trial come as a second, and then the case series will come in the lower bottom. Almost they are considered the expert opinion. So they have in the level of evidence chain, they have the highest and the lower grade, but still they matter. A case report makes a foundation for clinical discovery and offers detailed narrative of unique clinical situations and often identifies the new syndromes, adverse effects, and or rare associations. All those things that all the new fancy syndromes are there, there are all case reports actually in psychiatry, including even Othello's syndrome, um, Klinghoffer syndrome, all those things. So this is the one interesting case in history, which is a case report actually from how to write a case report in psychiatry. As a level of evidence, they are the lowest one, but still they do matter because of various reasons. And all those important syndromes that are there in the psychiatry, they're all case reports actually. And even rare adverse effects like Saturn syndrome and neuromalignant syndrome, they all came from the case reports. So this is the one important case in the history of psychiatry, not only psychiatry but in neurology, and made an impact in psychology also. About this case, he is a person working in the rail as a contractor, and then when he was hit by a iron rod, this iron rod is holding fast to his frontal lobe. So this is his name is Phineas Gage, and it is published in the Boston Medical Journal. And this revolutionized understanding of brain behavior relationship. Earlier there was a concept of mind and brain are different. So brain was taken by neurology and mind was taken by psychologists. And this showed that there is a brain when frontal lobe affects, how it changes. Then there are also another case from the published by Sigmund Freud and his colleague about dissociative identity disorder and delusional disorder by another one. These are famous cases in psychiatry. So the importance of this I will summarize here in this table. The Phineas Gage case was because of the frontal lobe injury linked to personality change, and this laid foundation for neuropsychiatry. Still now we use it about frontal lobe functions. The neurologists became more aware of the lobar functions and executive functions, which do it as a part of the frontal lobe, which the psychologists prefer it. Anavo is from the taking talking cure or basis of psychodynamic psychoanalytic psychotherapy, where they showed that the historical psychosis or so-called hysteria, it was thought to be related to a wandering uterus, and they were able to cure it based on their analyzing over the many months of talk that is known as birth of psychoanalysis. SSRI induced mania came into from a basic simple case report. We thought that SSRI was a safe, and we have to worry when you are even treating a student with any depression whether you have to wait for or worry about switch to mania. The other case report by Joseph Dalmu came in 2007. After this, many case reports are there. I have seen in many of the conference also about anti-NMD encephalitis and associated psychiatric symptoms. So this changed the approach from primary and secondary psychosis or organic versus functional psychosis very much. Psychiatry needs case reports because the presentations are heterogeneous and they change with the timing, social context, and cultural context. Case reports highlight the complexity and they promote empathy and also reflective practice and ethical reasoning when you write. And for educational impact, this applies to postgraduate students that case writing definitely improves the clinical reasoning and documentation. It builds a habit of structured observation and doing a simple literature search. It enhances academic and communication skills. Ethically, you this is insistence from all the journals, and you will know how to take a consent from the patient and maintain a confidentiality. Encourage responsibility in clinical storytelling and fosters respect for patient narrative and autonomy. Before we write a case report, either for a journal or for a presentation for a conference as a poster or a brief presentation, what you can do first identify a case, whether it has educational value or unusual or diagnostic value. Discuss with a mentor. The case report should be identified and written by a junior most person. That's usually a postgraduate student, and but it should be discussed with a senior person who can tell it is a unusual or rare or it is different. It requires experience to tell that this is worth reporting. And sometimes where there is a case series, especially those who have an intervention or a surgical intervention, they require institute ethics committee even if we are making a case report or case series based on the retrospective data. Perform the literature search to justify that there is a novelty in this case that we are going to report. Title should be concise and descriptive, and abstract is usually unstructured is required. It's around 300 words, and even if it is structured, it only has a three headings. It doesn't have this embroid what we use for original research articles. Structured abstract will contain only background and the case about the case description discussion with a conclusion. Only actually three parts are there. Summarizing will summarize the clinical takeaway in one sentence. Introduction section should describe the background, why the case is worth reporting. State what is known about such cases and what is not known about such cases and what your report adds to this. This actually should come at the last in the conclusion also. Patient information, you can include age, gender and occupation, social and medical background, present chief complaints and onset of progression, but no personal identifier should be included. Clinical findings should describe briefly about physical and neurological findings relevant and then provide a mental status examination and summarize the key psychological or neurocognitive some tests you have done or you have done any imaging uh, that images should also be included. Use a table or a figure to show the chronological flow, how he came, how the symptoms changed, how his response happened. Include investigations and reasoning for diagnosis. List differential diagnosis considered rational for exclusion. So this is one example over the treatment course, or the ward stay, or during the follow-up. You can mention the change in the scores or the any rating scale, or change in the any particular values of blood values of any biochemical parameters over the time. If you are given particular any intervention, describe the pharmacological, non-pharmacological management, and then include medications, names, dosage, duration, and psychotherapy details if you are given. Sometimes this is one I have taken from a case report where it says that they have describing a difficult to manage aggression, agitation in an emergency setting, and they have shown what all medication they gave, but still they are not able to settle the person's agitation and aggression. So, but time wise they given the medication names, they should be in a generic, not brand names, and they should include the dose, and then the route it is given. Okay, so these are the must in a case reporting. And then follow up and outcome, if there are there, they're very well welcome, they're more likely to be acceptable. Highlight the response to trajectory, side effect, and relapse. A longitudinal follow up strengthens more impact. If you have a follow up to the description of the case about 6 months, 2 years follow up, or longer follow up, what happened, then it will be strengthens the case report. Discussion section should include interpret the findings with a balanced reasoning, and compare with the existing literature, discuss implications, limitations, and lessons learned. Patient perspective, this is a new thing that has been added nowadays. Earlier it was not there. So after any intervention, or after a treatment or diagnostic difficulty, or a rare presentation, or a rare side effect, you have made a case report. Usually many journals ask the patient party to speak on their experiences. So it is known as a patient perspective. It includes a brief reflection written by the patient if possible, or you can write as he says. So it makes a humanizes and contextualizes psychiatric care. And ethical considerations are confirm that in the case report you have to mention that the written informed consent was taken, and avoid all personal identifiable details. State that institutional ethics approval may be required in some of the case series, especially those that are having interventions or surgical interventions or implants. And this all this thing has been simplified by a care guidelines. Care guidelines means this case reporting guidelines, and this is the published in 2017. It elaborates each of the item and also gives a checklist. Care guidelines is should be used for writing a case report. In fact, if you mention that we have adhered to the care guidelines while writing this case report within the case report in the introduction part, the chances of that acceptability will be increased, because the editor of the journal knows that you have adhered to this correct guidelines. The narrative is a case report, tells a story in a narrative format that includes the presenting concerns, clinical findings, diagnosis, interventions, and outcomes, and even including rare adverse events and follow up. The narrative should include a discussion of the rationale for any conclusion and any takeaway message. This is what is the core of the case report. The case report guidelines standardizes this in a structural format. It includes a title, abstract, introduction, case details, timeline, discussion, consent, and always check with a care checklist. It gives also a checklist. So this is the checklist I have included in this screenshot. So it says that in the title, you should include that it is a case report. You should mention the case report and the keywords which can identify this entire article with a 2 to 5 keywords. Abstract should have introduction and what this case add to, and then the briefly report of the case presentation conclusion, which should be not exceeding beyond 300 words, and sometimes they ask 150 to 200 unstructured without any headings. That is unstructured abstract is required. And it also mentions what should be included in the introduction and what should be included in the patient information, clinical findings, diagnostic assessment, therapeutic intervention, follow-up outcome, discussion, patient perspective and informed consent. So this can be used when you write up case report before submitting to any journal. You can use it as a checklist. Patient identifier, we all know that this should be removed. That potentially can identify a person, this should be removed. In the images, if you are using, the image should be properly labeled and written, otherwise they are likely to be rejected. In psychiatry, there are not much images, but if you include any images, there is a especially in multidisciplinary case report, like in medicine or neurology. So chances of that accepting will increase. Where to publish? We will suggest that you can go for Indian journals first. If you have not had any experience of any uh, publications, go for Indian journals. Whether it is indexed in PubMed or not indexed in PubMed doesn't matter. Um, Go for a indexed journal. So these are the common ones. BMJ case report is meant only for case report, and BMJ psychiatry also accepts case reports. Frontiers and Psychiatry and Indian Journal of Psychological Medicine. And now with the IPS, every zone of the IPS has its own psychiatry journal, whether it is south, north, east, and west. So even Tamil Nadu state also has its own journal. So you can also target as a in that journal to submit your case report for a learning purpose. Consider open access. Open access means you have to remember, you have to pay to get it published in the journal, even if it is a very good quality case report. In the list that I have found, out of 91 list where the case reports are readily accepted, which are relevant to psychiatry, there are only few. That's number 40, which is about case reports in psychiatry, and then clinical case reports 51 number, and serial number 57 is epilepsy and behavioral case reports. And then there is the International Medical Case Reports Journal and Journal of Medical Case Reports and Sage Open Medical Case Reports. Remember that if it's only open access, we have to pay for the article processing fees. Sometimes it can be in lakhs. So we be careful about this. Sometimes they do offer concessions for students or those from the low and middle income countries. Mm. The second one is that there are some predatory journals. That means you submit it, they'll accept it, and then after publication, they will ask you to pay the charges. And if you refuse, you cannot withdraw it, and they will hold it for a long time, and you are stuck. It's like a trap. So be careful about these things. And choosing a journal, as I already stated, these are the common ones. And whenever you are submitting for a journal, you make sure that you have read the author's instruction. Each journal, there's a difficulty. Each journal will have its own author's instruction for how many words, how should be formatted, what should be the referencing style. So this should you should follow it before submitting so that your accepted increases. Otherwise, if you don't follow author instruction, when you submit it, the editor sees at the first time you are not adhering to their instruction, then they will reject it at the first time itself. Formatting and clarity, you should bring a clear subheadings and concise paragraphs, include illustrative figure and tables, more likely that it will be accepted, and ensure consistent and logical flow. Avoid overstating the causality. Only many times it is association. Insufficient literature review is the one of the reason for rejection, and omitting consent or not having enough follow-up on this case period case of follow-up, that will also be reason for rejection. And poor anonymization, that confidentiality are not maintained, you are not removed the personal identifying identifiers from the case report, it also could be a reason for rejection. And since we are poor in English, we can use a grammarly this thing to improve our English, or give to somebody who can read English good in English, and they can ask him to proofread before submitting to a journal. Write early when the case is fresh, especially when you are seeing the case, they should time that decide actually, not when the case has gone. So you will feel that many things need to be done, investigations, and you will not be able to do investigation, and it remains incomplete. Use a active voice and a plain English, and ask colleagues for a proofread it before submission. So before this also, then I will include some of the case reports that I have published, not to show that if I can publish with a poor English and from here in our neighboring states, then definitely you can also publish. The publication should always start initiated from the junior most, that is a PG, who is saying and working up the case of the lot, and then other faculty can be included. Usually, the senior most is given the last authorship, all also becomes the corresponding author. Corresponding author is usually a person who is a regular employee of that medical college. So this is the one case. we got this thing published long back. Why do you think it could have published? The reason it got published is that drug-induced respiridone usually are a bilateral tremors. He had only unilateral tremors. That's an unusual case presentation, and he has also vitamin B12 deficiency. So it is just a hypothesis generating. Then this is the one, since it is published under the in India, I think it got published in Indian Journal of Psychological Medicine, I believe. Yeah, correct. Indian Journal of Psychological Medicine. Since the heading is there under the case report, in the title you do not have to present as a case report. Otherwise, in the title you should include as a case report. Here we brought it, it got it accepted immediately because this is a well-known case that the Dart syndrome or the Samain loss syndrome. But we raised the question whether it should be a psychological or physical illness. Now, Ayush doctors are from the High Court order also are eligible to practice as a registered practitioners, and many of them also do allopathic practice. And the Siddha always believes that it is a different theory about how it is a illness. It's a medical. It's a illness, and we don't believe it as a illness. So this causes a conflict when the person or a patient moves from one system to another system of medicine, because for him everybody is a doctor. So we brought it, and then respiratory and associated paralytic ileus. This is rare because constipation is well known. And when the Respirodon came, he said that it has a poor, very less anticholinergic property, less chance of constipation. But we had a case of paralytic ileus, so that's what we thought it is reported, and we reported it, it got published. One mistake we did was that because it was managed by surgery, we should have included a surgery because it will increase the strength of this case, and also they also can have some other insight into this case report. So always go with a multi-specialty and a group. You can have up to 6 authors. This is another case report that was published. See, it is the case report. You can also write not only as a case report. If that section is there, you can also submit under the correspondence or as a letter to the editor. This was published as a letter to the editor in Australia and New Zealand Journal of Psychiatry. This is the case report, and it has a good impact factor, citation factor, and this case report is seen in a single page. It includes just no sections at all. Otherwise, they usually have an introduction, then the case description, and the last one discussion, including conclusion. So the single case report on a single page. It is about a trichotillomania. It describes, and its impact increased, accepted increased because it was written well, and it is initiated by our JR Vivek Arun Kumar when he was a junior resident in doing his PG in psychiatry, and we had a collaboration with Department of Dermatology. The two authors are from the dermatology, and then we had images, and we had a follow up. So these things increase the chance of acceptability. This is the another one. This is a case series. This is about benzodiazepine maintenance for alcohol dependence. So the reason why it got accepted was it was a controversial topic. For opiate dependence, we have heard about as a part of the harm reduction, if they're not able to detoxify and remain abstinent from opiates, we give a substitution up as a part of harm minimization. Substitute to the less stronger or long acting opioid like methadone or buprenorphine maintenance. Like this concept came, and we didn't have this concept for alcohol dependence. And for alcohol dependence during withdrawal, we treat with the benzodiazepines only in the initial 1 week when the withdrawal symptoms are at the peak, and the benzodiazepines, especially alcohol and chlordiazepam, almost act like a alcohol. So it's a replacement for alcohol, and for during detoxification it's used. Usually, all clinicians, including psychiatrists, advise not to give it further for a longer time because of the chances of potential chance of addiction to benzodiazepines and potential chance of uh, a diversion. All those things they used to talk, and even pharmacy will not give it for a longer time. So what you did, we didn't do it any study. We only took a retrospective studies that were under follow-up with the direction, and we made a case series. This case series consists of 10 cases where we go through all the case record that are maintained and when they were started and how long they took it, and they were maintained on just 5 to 10 milligrams of diazepam beyond even standard to 1 week after the treatment of alcohol, and there was Many of them were not using alcohol, abstinent, but are maintaining 5 and 10 milligrams of diazepam only as prescribed. And we checked whether they had been abusing or had a dependence criteria for benzodiazepines like diazepam, and they didn't have any dependence. So that's what I reported, and it got published. So we presented this in a tabular form, or you can also present in a column wise for case 1, case 2, case 3, case 4, up to 10 cases. In their socioeconomic data, all these things can be presented in the tabular form also, that are acceptable. This is how it is, and any new thing especially comes like zolpidem came when it was introduced. Zolpidem, it was introduced as a non-benzodiazepine, non-dependence causing sedative. But later we came to know that there are people who have become addicted to zolpidem, taking 20 to 40 tablets per day. So these can become a case reports. So any new or novel medication when it is introduced, we do not have its full length of strength, full list of its rare side effects and other adversities. So only when you use it in a larger and larger population, we will come to know the side effects. So these can be reported as case reports. So before you write a case report, the people feel a difficulty is that not just case report. When you're submitting for a journal, you should read the journal instructions and also prepared some documents. This is called as one is a cover letter. The other one is cover letter is written to the editor, address the editor, highlighting what you are submitting as a case report, what is the importance of this case report. And it should have a corresponding author's name who can correspond with the editor in an email contact. Then title page includes all the list of authors in their hierarchy along with their full names, their designations, their institute affiliation along with their email and the phone number. Then comes third comes the main article where your entire article should be there along with abstract keywords and the entire this thing along with the references, tables and everything. The one more thing that is included in this is the format for submitting any article to any journal. But one more thing extra that is added to this case report is the patient consent form, where you have to get a signature from the patient that he is giving permission to present his case or his photograph in the journal, because the journals sometimes are read by public and it is in the public domain. And the last one is a copyright transfer form, which is a standard for any journal. So they will ask you to signed by all the authors and co-authors and transfer this copyright to the journal. Briefly to say same thing, the cover letter should include editor to the chief about telling the highlight of your case report, why it should be considered for a requesting to consider for publication, and we have read the scope of the journal. That's what you have to mention along with the corresponding author's name and address. Then the title page includes the what is the title, running title is a short brief title, and then all the contributors, author's name, their designation, their institute name, phone number and email, and also the number of pages, word count for abstract, word count for the text, and number of tables, figures, and anything is included, along with financial disclosure and acknowledgement, conflict of interest. Conflict of interest, this is a standard. In acknowledgement, you should mention all those persons who have helped and are useful in this writing a case report, but do not qualify for authorship. Many journals also want you to take consent from the person whom you are naming in acknowledgement. The main article should contain your case report written, and we usually use a BMJ case report. It gives a template actually how to write a case report. So it has divided to different subgroups, and also gives how to write a title, what it will include, how it should be the abstract, how should be the introduction of background, how the case presentation should include all things, and how to mention the investigation, differential diagnosis and treatment. So we can make use of this such a case report templates and write our article. And consent form for a case report required, where this it is a standard one, but each journal will insist that they use their case report consent form, and it will be there downloadable in their website. So it should be signed by the person or the patient. And copyright transfer, as I said, all the authors need to be signed this, and then transferring their copyright over this article published to and images published to the journal. In open access, where you pay for the publishing of your case report, you retain the copyright. You do not have to transfer the copyright. Why it is important for postgraduates? Because it develops academic confidence and recognition. Once your name is there, it will be there in for many years, and somebody will quote your case report. So that becomes a recognition, and it strengthens your curriculum and research profile. You will be considered one of the researcher and encourages evidence-based and reflective practice. So it will also make you know how to collect and carefully observe each case. Indications for writing and publishing a case report in psychiatry. It describes, you think about that it should worth a case report when it describes a rare or novel condition. You are trying to highlight an unusual side effect or adverse drug reaction. A report a new use or a off label of a known treatment. For example, a case showing benefit of ketamine in treatment resistant OCD. So almost like if you consider treatment for a resistant catatonia, most of them are case reports, whether it's amantadine or zolpidem, they're all case reports, and demonstrate that a new association of comorbidity, for example, depression associated with interferons, or a rare metabolic and neurological disorder, or even a catatonia associated with autoimmune encephalitis. These are rare, which are not just started to come up. So now this is also worth mentioning, and illustrate a diagnostic challenge or errors. You should definitely there is a problem in diagnostic errors or accuracy, then it should definitely worth in reporting. If we show that culturally influenced symptoms or responses are there and relevant to Indian population, this should also be worth mentioning. And if there are any ethical problems, psychosocial learning values, especially boundary issues, consent difficulties, cultural aspects of psychotherapy, can also be written as a case reports. Case reports remain as a stepping stones. They often inspire systematic studies or trials, and several psychiatric syndromes were the first noted as a single cases. Before I conclude, every new insight begins with a single patient story. You need to observe carefully, question and document and share. So that is how science evolves. And with this, I will conclude. Anyhow, I'm reachable. And this care guidelines is the one which you should use, and BMJ case report template, that's the one which will help you to write a case report. So that's all from my side. Thank you. Yes, yes,
Okay,
yes,
well,
correct.
okay.
Thank you for everyone attending. Thank you, sir.
Thank you so much, sir.
Thank you. Thank you.